Dr. Eric Balcams, we're back for another edition of Thyroid Thursday, and today we're talking about gluten intolerance and what the impact it can have on your GI tract and your physiology, especially your thyroid physiology, if you have loss of tolerance to it, you have gluten reactivity, gluten intolerance. You don't necessarily have to have celiac disease, but just have a loss of tolerance to the peptide in wheat called gluten, and more specifically gliadin. Okay, so what happens when you eat it? That gliadin binds to receptors that initiate an inflammatory process in the GI tract. Once that inflammation starts to occur, that can have an impact on the thyroid hormone directly in the GI tract. So we get a reduced conversion of T4 to T3, so that can create problems with digestion, bowel movement, motility, tight junction control. You can also have this inflammation can start to trigger dysbiosis, an imbalance of the bacteria in the GI tract. Why is that important? Because the bacteria kind of helps regulate a whole bunch of things, especially the tight junctions in the GI tract, because the bacteria, certain types of bacteria, make stuff called short chain fatty acids that help maintain the tight junctions in the GI tract. So really important. Dysbiosis can lead to more inflammation. It can also create a lot of different signs and symptoms. So when we eat gluten, you get the inflammation, you get decreased conversion of T4 to T3, you get dysbiosis and imbalance in the bacteria that starts to build up. And then some of those bacteria can actually bind to the thyroid hormone, preventing any thyroid hormone that's converted to be actually absorbed by the body. Or if you're taking thyroid medication, can reduce the amount of thyroid hormone medication that you can actually absorb. So you wind up taking a much stronger dose than your body's size would typically indicate. Number 4, when you have this dysbiosis and inflammation, this can cause a reduction in micronutrient absorption, and that can affect the production of thyroid hormone, that can affect the conversion of T4 to T3, and it can impact a whole bunch of other systems and reactions as well. So we get decreased cofactors. Number 5, the dysbiosis and inflammation results in increased intestinal permeability. We already talked about this a little bit. Remember, the bacteria determines what happens with bile acids, and bile acids help control the tight junctions of the GI tract. The bacteria can influence the tight junctions because if you have dysbiosis and you have this inflammation, you have less T3. There's less T3 to maintain the tight junctions, and bacteria produce these things called short chain fatty acids that also help regulate the tight junctions of the GI tract. So what happens when you have this intestinal permeability? If you got chaos going on in the GI tract and you're not breaking down foods appropriately, and you start to have more intestinal permeability, now more undigested peptides, not just the gliadin peptides, but other peptides, any proteins that you eat aren't being broken down appropriately, they can cross the barrier, cross this leaky barrier, and now they can trigger an upregulation of the immune system, upregulate the immune system. They can result in food sensitivities and food intolerances, and they could potentially lead to what we call molecular mimicry, where you start attacking maybe your own tissues. Remember, the health of the GI tract, and especially those short chain fatty acids, is really important to help regulate what's called the T regulatory cells. So real quick, what is a leaky gut? Does everybody have a leaky gut? Everybody's got some level of permeability in their GI tract. Think of the screen in your window, right? There's small little holes to keep the bugs out, but let the air come in. It has a level of permeability. Your GI tract has a level of permeability, but when it's intact, really small nutrients cross, but not big things, not bacteria, not a lot of the toxins, not undigested food proteins and peptides. It should be micronutrients that are absorbed. But if I walked up to your screen window and I put my fist through it, now you've got a bigger hole in your screen. That screen has just become more permeable, and now more bugs and butterflies and stuff can come into your house. If your GI tract becomes more permeable, undigested food proteins, organisms can cross the barrier, come into the body proper, and trigger immune inflammatory conditions. So number 6, when you eat gluten, all this stuff occurs. We get more what we call circulating damps and Pamps. Damps are pieces of damaged material that enter into the bloodstream that can trigger an upregulation of the immune response. And Pamps are pieces of organisms, pieces of the bacteria in your GI tract, something called lipopolysaccharides. LPS is something that's talked about quite a bit that can trigger immune activity and inflammation systemically. And when you have these more damps and Pamps in circulation, they can actually bind to receptors on the thyroid gland and initiate thyroiditis, which is often the primary cause of what drives hypothyroidism at the tissue, at the gland level specifically. And then number 7, you can have systemic inflammation that's occurring because you've been eating a bunch of wheat and gluten that you're reactive to. This causes, especially early on, an increased T4 to T3 conversion at the hypothalamus, but it causes decreased conversion of T4 to T3 in the periphery. So what happens is you feel hypothyroid signs and symptoms because there's decreased T3 and free T3 in the periphery. You go to your doctor, but because of this inflammatory upregulation or increased conversion of T4 to T3 at the hypothalamus, your TSH is normal or maybe even low, and your doctor says you don't have a thyroid condition. And then you also have this upregulation of reverse T3 that doesn't bind to and block receptors, but just indicates that, hey, there's less available T3. More T4 is being converted into reverse T3 versus T3, and that results in the slowing down of the metabolism and you feeling hypothyroid. So what do? Well, there's a couple options. Definitely, if you know you have gluten intolerance, don't eat it. I mean, that's the easy thing to do, is just avoid it. Now, it's not always easy, but you should work to avoid it so that you're not reacting to it. The second thing to do is if you do consume it, then you can take an enzyme called a DPP4 enzyme. US Enzymes Master Supplements has a great one. It's called glutathione, and you can take this enzyme, right before you're going to eat something that's got wheat or gluten in it. You can take some late after you've eaten it to help speed the breakdown of the proteins that your body or peptides that your body might be reactive to. So those are 2 strategies that you can apply if you consume gluten. Now, will an enzyme kind of allow you to eat all the wheat or gluten you want? Probably not, but it's a good band-aid if you consume some because you don't have another choice, or you really feel like I need to have whatever that food is that's got it in it. That can be a tool that can help you reduce the inflammation. Now, somebody's going to say, well, how do I know if I'm gluten intolerant? Well, there's some tests that are available out there. Cyrix Labs has a fantastic test that looks at all the components of wheat and to see what component you might be reactive to. There's some other companies that have them out there. If your doctor just did the standard celiac panel, that's only testing one component of gliadin, 33 mer component. There are other pieces of wheat that you can be reactive to. So just because you have a celiac panel done and it comes out negative doesn't mean you do not have gluten or gliadin intolerance. So you need better testing to determine that. If you eat gluten and you have GI reactivity, you have you have symptoms that are outside the GI tract, maybe headaches or migraines or congestion, you get more thyroiditis, your throat gets tighter, right? You get a rash or skin breakout. If you have a sense that you're reactive to it, you probably don't even need to spend the money for the testing. Just avoid it and see how you do without it, okay? So this is Thyroid Thursday for this week. We talked about what happens when you eat gliadin, when you're intolerant to it. Increases inflammation, increases the risk of autoimmunity, increases the risk of more food sensitivities, more food intolerances, more chaos, more dysbiosis in your GI tract. So best thing to do is avoid it. And 2, if you can't avoid it, make sure you get a enzyme like glutathione from Master Supplements and take that pre and even post consumption to help reduce the potential risk of inflammatory damage. Okay, if you have any questions, put them below wherever you watch the video, and I'll try and get those answers back to you as quickly as possible. All right, take care.